Hey everybody, and welcome to the Botanical Biohacking Podcast. We have 3 episodes in a row that are really incredible because we get to talk with Dr. Tom Whalen. He is a Zen priest, he's also my Zen teacher, and he's an anesthesiologist. We start the days with morning meditation for about an hour. Then, at the clinic, he treats patients. I treat many of the same patients. We have an incredible group of people who we have the privilege to treat. And we do everything in our power to do our best for them. In this episode, we're going to talk about how mental brilliance has a hidden dark side, how it can lead to stress and burnout. And this is something that both of us have experienced to one extent or the other. When you're up late at night really thinking about your patients, when you're working really hard, when you're putting in 17-hour days to start up a business, it can lead to burnout and eventually a crash if we're not careful. So how do we maximize our energy levels? How do we prevent this? How do we make sure our brains are functioning? Because the reality is, you're not competing anymore with the people in your town or the people in your office. We're in an era of global competition, which means if you want to shine in this life, in this era, at this time, you're going to have to be better than everybody else in the world at what it is that you do.
I'm really excited to be here with you both today. I'm really excited to have this opportunity at this stage in my career to be working with you both now. What you said a few moments ago about burnout it's a perfect description of a part of my life. It's a part that I sometimes would like to forget, but it's important for me to remember to be able to connect with other people who are suffering through burnout. When I graduated from medical school, I had spent hours studying. I was Alpha Omega Alpha. It's an honor that's given to the top 3% of medical students in the United States. I then went on to complete a full internal medicine residency and got boarded in internal medicine. I was spending hours and hours studying. Then went on to do an anesthesia residency. My anesthesia residency, once again, I studied for hours and hours, and when I finished the program, I took a written board examination and had one of the 5 highest scores that had ever been achieved in my residency program. I was doing this on 4 or 5 hours of sleep a night when I could get to sleep. I was on call every 3rd or 4th night, often not getting any sleep. When I finished my program, I became an attending. And instead of settling back into a practice that was life-sustaining, I took on the responsibilities of being an attending at a university hospital in all the 5 divisions of our anesthesia program. Once again, I was on call every 3rd or 4th night, getting very little sleep, studying so I could teach residents, thinking that I was helping people by doing these things. My personal life was falling apart. I was becoming a total jerk. To try to minimize the internal pain that I was feeling but not admitting to, I turned to drugs that harm the brain. It was injecting IV fentanyl, the drug that everyone's hearing now that's killing so many people. The risk to me was somewhat less because it was pharmaceutical grade and I knew the dose that I was getting the drug. I wasn't buying it from somebody on the street. Nevertheless, the drug was completing the damage to my brain that the overwork and the lack of sleep, the fast food diet was all contributing to. Within a matter of a couple of years, I was completely burned out. my drug addiction became public knowledge, and I was forced to leave practice of medicine for about 1.5 years, which was a real blessing. I got to start to get my life back in order. I had been practicing meditation for some years before my excursion into the deep, dark recesses of drug abuse, and I returned to doing that, meditating often an hour a day. When I returned to the practice of medicine, my life was more balanced, and I wanted to be able to pass some of the information on to other people, some of the healing that had happened for me. And I was aware that most people are not in a position to spend an hour a day practicing meditation. You have to do something like that if you want to become a Zen priest, a Zen teacher. You don't have to meditate an hour a day if you want to balance your life. As a part of my ongoing search and meditation practice, I explored several different forms of meditation. And one that I've found that's very helpful for people very quickly, that can be done in 10 or 15 minute sections, is a practice that we've started doing together and offering to our patients in our clinic. I also became familiar with hypnosis and Emdr through a good friend of mine who's a PhD psychologist in Vermont. And hypnosis and Emdr, which is an eye movement practice that can bring very rapid results for people suffering with PTSD. It's another one of those potential shortcuts to healing for people who are suffering from burnout. Another area of treatment that I became interested in about 10 years ago was the use of ketamine to treat damage to the brain. What I saw very quickly with the use of ketamine is that it provides very rapid changes in the brain, very rapid decreases in inflammation, very rapid rewiring of the brain. But it tends to be short-lived if it's done alone. Its results tend to last for 2 or 3 months. And I didn't want to begin a treatment program that encouraged people to come back every 2 or 3 months to get an IV drug infusion. I was looking for other techniques, other practices that could provide quicker, shorter healing processes. And when I met you with your wonderful practices of Chinese medicine, herbal pharmacology, I'd finally found the things to fit into the puzzle to make it complete. So thank you very much for having me here and for working with me on helping so many people. I'm curious where you see ketamine and the use of Chinese medicine, herbs fitting together.
One of the most important ways that acupuncture and herbs work when treating burnout, PTSD, depression, is to drop the inflammation. And this is often the first and most important hurdle, but it's often tricky. When people, as you're aware of, they have a high degree of inflammation in the brain, it becomes very tricky to get to sleep. You need a certain amount of inflammation to get to sleep, but if there's too much, it can disconnect the brain so that it's harder and harder to gear down and get into that sleep state. That's where people really get derailed. So the first few months of treatment with Chinese medicine is really geared toward lowering that inflammation so that there's not such a spike in nitric oxide, so that people can actually get to sleep. And once they're able to sleep, the body can restore itself. After that inflammatory stage, then we move to a stage of restoration. Looking at the way that that sweet spot of ketamine affects brain tissue. So if you have too much ketamine, it's not going to do the trick. If you have too little, it's not going to do the trick. But if you have an experienced anesthesiologist give you that sweet spot of ketamine, what it does is it can start the process of, first of all, dropping inflammation like a rock. So the 3 months of Chinese medicine, it kind of zigs and zags as the inflammation gradually comes down. But somebody has steak and really warming food, or they drink a little bit, or they pull an all-nighter, and the inflammation is right back where it was 2 weeks before. And it's a very frustrating process for everyone involved. What I've seen with patients who are using that sweet spot of ketamine is the inflammation drops like a rock, and within 24 hours, it's basically accomplished what the first 3 months of Chinese medicine is used for. After that, we can focus on really nourishing and regenerating that nerve tissue, which is already part of what ketamine is doing. So it's just so harmonious and so fast. And this is crucial because so many people, I can speak from personal experience. I think, okay, I'm just pushing a little bit harder, and then I'm brain dead from overwork, from my personal burnout experiences. That's what happens. Now, if you're in charge of a big project, if you are responsible for other people, you may literally not be able to afford burnout or the 3 months it may take to meditate, use Chinese medicine to get yourself back on track. The way that Dr. Whalen just described, taking that year and a half off, he was able to take the time and do the meditation to get a lot of those neuroregenerative effects. Meditation, the relaxation response in general, has an anti-inflammatory effect, and it also has the ability to regenerate brain tissue. That's a beautiful thing. That's one of the reasons why we're not leaning, some of these clinics that are ketamine clinics, they say ketamine's the answer for everything. It's not the approach that we've been taking. We use it as a pattern interrupt, and then afterwards really use the nourishing effects of the herbs, the acupuncture, and meditation, breathing practices to give people the tools so that they can really just take it and run with it and use that actively as part of their lifestyle. So initially, as somebody who's trained in Chinese medicine, you tend to favor your own tool set. It's, everyone tends to prefer or appreciate what they have and kind of look on with maybe suspicion at what you're less familiar with. So initially when I heard about ketamine, I thought my own experiences with it had been treating people who have taken it recreationally, and I've seen it make acupuncture all but useless because it shuts down the nerves. But in the hands of somebody who's experienced and very professional with its use, I've seen very, very incredible changes that, as far as bang for the buck and turnaround time, it's potentially life-saving because many people go from a state of burnout, to suicide. It happens quite a bit.
Yeah, I mean, a third of drug counselors leave the field every year, either completely or switching their place of employment because they're burned out or depressed. First responders have a very high rate of burnout. We're all aware of the struggles that our military veterans go through, struggling with PTSD. People in sales, they're faced with the pressure of making sales every day. They can't afford to take a year off to get themselves feeling better so that they can make a sale.
They're essentially selling their mental and emotional state. Everybody out there who talks about success talks about mental attitude. You've got to be positive. You've got to think positive. Yeah, that's true. And also, that positivity and keeping your brainwaves on high like that has its costs as well. That's turning up the heater on your car. That's running the engine. But if you're not able to gear down and restore, that's burning the candle at both ends in many ways.
Exactly. My reluctance to dive into a purely ketamine clinic because I was aware of its short duration of action, I had always found or thought of as being similar to the effects of motivational programs. People get whipped up into a higher state. They can push themselves a little higher to get a little more result for a few weeks, a few months, maybe a year, but the damage to their brain hasn't been healed. And one of the things that we have to be aware of and have to help people to understand is that these problems are not purely quote-unquote emotional states. They're physically damaging states for the brain. Trauma, the inflammation from trauma causes damage to nerves and to their connections to other nerves. The emotional centers of the brain are disconnected from the rational parts of the brain. And as much as people know that they're having problems, as much as they rationally want to change, their emotional centers have been hijacked. Willpower won't do the trick for changing this. If the willpower brings people to an appropriate treatment program, then the healing, the physical healing of the brain can take place that will lead to emotional healing, relationship healing, spiritual healing. But we can't disconnect the physical damage from the other problems people face.
Absolutely. My understanding as well is that the more trauma and emotional turmoil you experience in life from the past or whenever, the more it derails these crucial connections in the brain. And this contributes to weight gain, insomnia, and poor decision making because these feedback loops in the body are getting derailed. So you see these people, they're just really motivated. They want to turn their life around. They want to get to that next level. They go hear somebody who's motivational talking about, you've got to be in the right headspace. You've got to go for it. But the wiring just isn't there for it to happen. It's like it takes their goals and dreams and expectations and just pushes it out of reach. It's heartbreaking to see because, just imagine that you have an old laptop and you've used it a lot and the battery life is like 30 minutes. You can charge it up, you take it to a cafe and you're about to write a paper and to write this paper, it's going to take 8 hours. But there's just not the battery life there because it's been burnt out. The same thing I see with so many people, they're pushing and pushing themselves, but to do a big project and work with people and have the emotional states to really get things done, you have to have a longer battery life than what most people out there are trying to work with. And what's sad is they have the best intentions, but they can't seem to get it. And you see them just push themselves and crash again and again and again just because the wiring isn't there. It's ironic as if they spent time not necessarily amping themselves up, but introducing meditative techniques into their every movements in daily life, they would be able to extend that battery life and actually do what they've set out to do, what they maybe were meant to be doing. One of the benefits as well of taking these meditative practices and going with them in the long run is you get the reset and are able to introduce that into daily life.
Yeah, once people have healed their brain with some techniques that actually don't take a lot of time, then they can do incredible things. And they can keep coming back to these focused healing techniques to allow themselves to be creative and energetic and loving, reaching their goals and dreams.
When you were going through your first, kind of major burnout, did you find, I'm just speaking from personal experience, that the more I've been burned out in the past, just pushing harder than I had the reserves for, it became harder and harder to recharge my batteries. So what may have taken me an hour to recharge, it was taking half a day. And of course I wasn't giving myself that, so I would keep going. And I started to feel this feeling like I wanted to escape, like there's this low-grade anxiety or panic. But, I would try to get out of it by thinking my way out of it. Like, okay, I'm unhappy or I want to escape. How can I think my way out of it? But of course, my brain was already overheating. Did you experience something similar?
Oh, yes. I would try to think my way out of it. Okay, I'll do this research project that will make me more valuable to other people. Mm-hmm. I'll take on an extra patient load, an extra night's call. That'll make me more valuable to other people. This is crazy thinking. Mm-hmm. My brain was already overheated. I wasn't thinking right. And unfortunately, the culture that I was in, the healthcare culture at that time, and to a certain extent, it's still that way today.
It's a badge of honor to fry your brain.
Right. It encourages that kind of craziness. Mm-hmm. And when I'd get
business culture too. Business culture is all about just fry yourself, and if you're not giving it 200%, then you're weak. And
if 200% isn't doing it, then you'd better give 225%.
Right. Although if you look at world history, any society who's really built anything impressive, they've had a pretty good approach to life balance as they've done it. Not to say work-life balance as in, I'm going to spend 2 days with my kids and 2 days working, but they've approached work with grace and play. And they've been in that flow state. And they've had methods to maintain that flow state. And that, I think, I was familiar with many of these methods as I was burning myself out, but I was also pushing that much further than what I had. I think, sometimes ego plays a part into it. Sure, other people need that much sleep, but I don't because I have these other methods. Other people, mortals need to rest. I don't need to rest. Yeah,
I wanted to be a god too.
Right. That's why you get into, medicine, martial arts, right. This kind of thing. You want to have power over life. And, that's why you get into business too. That's why you push yourself oftentimes. It's not always for ego. Sometimes it's just for love for the people around you. You want to do the best that you can and give everything that you can. And unfortunately, we can all go from having tremendous passion and love for life. And just from that giving out everywhere else, we tend to get colder and colder on the inside. And if that's not being filled for whatever reason, then, we can get very cold emotionally. And I've seen people who have had tremendously successful businesses, careers, relationships, throw all of these away. And I've even seen incredible people commit suicide in an attempt to get out of this cycle. And it's just so sad because there are such elegant and really beautifully elegant ways to not only escape this cycle, but use what you learn as you've fallen in this cycle to make sure that you function more efficiently for the rest of your life. I think all of us get burnt out to a certain extent now and again. It's not necessarily the worst thing, but it is important to learn from and use it as a turning point to rewire yourself for greater happiness and success.